All right, good evening, everyone, and welcome to tonight's Red Tier edition of our COVID-19 community conversation. My name is Nick Morey with Sacramento County Public Health. We're going to start with introductions from our interpreters. Interpreters, when I call out your language, please introduce yourself and provide instructions in language. We'll start with Spanish. Stand by. Frida, we can't hear you. Hold on one moment while we troubleshoot this.
Can you hear me now?
Yes.
Perfect. Buenas noches a todos y bienvenidos a este foro comunitario del COVID-19 del Departamento de Salud Pública de California. Mi nombre es Frida y seré su intérprete esta noche al español. Les recordamos que si tiene preguntas, las ponga en el chat o en la sección de preguntas y respuestas que dice Q&A. Para acceder a la interpretación, si usted está en su computadora de escritorio o en su laptop, localice el menú en forma de globo que está en la parte inferior de la pantalla, haga clic en interpretación de idiomas y después seleccione español o Spanish. Si usted está en su iPad, su teléfono o un dispositivo similar, entonces localice el menú de 3 puntos que está en la parte superior derecha de la pantalla, haga clic en interpretación de idiomas y después seleccione español o Spanish. Gracias. Thank you.
Thank you, Frida. Next, we'll do Russian. Alexander.
Здравствуйте, добрый вечер. Добро пожаловать на сегодняшнее общественное собрание Community Forum, посвященный коронавирусу COVID-19. Услуги переводчика русского языка предоставляются. Если вы хотели бы воспользоваться услугами переводчика, пожалуйста, нажмите на изображение, подобное глобусу, в нижней правой части вашего экрана и выберите соответствующую языковую пару. Если вы пользуетесь не компьютером, а пользуетесь планшетом или планшетом iPad или мобильным телефоном для доступа к сегодняшнему семинару, форуму, пожалуйста, разыщите в нижней правой части экрана указатель с 3 точечками. Нажмите на него и выберите услуги перевода. Большое спасибо за внимание.
Thank you, Alexander. Next, we'll do Tagalog. Miguel.
Hello, magandang gabi po sa bawat isa sa inyo. Malugod na pagtanggap sa bawat isa. Salamat po sa inyong pagdalo dito po sa ating usaping pangmamamayan. Dito po sa pampublikong kalusugan ng lalawigan ng Sacramento, talakayan tungkol po sa COVID-19. Kung gusto po ninyo mapakinggan sa wikang Tagalog, ito pong talakayan, diin lamang po yun pong litrato ng mundo. At pagkatapos po, kung meron kayong mga katanungan, pakitanong lamang po ito. At ito po ay pakisabi lamang po dyan. At kayo po ay sasagutin ng ating mga tagapagsalita, ay isusumite po inyong mga katanungan. Salamat po sa inyong pakikipagsali sa amin.
Thank you, Miguel. Next, we'll do Hmong. Laura.
nhớ rằng trong xe tại tòa trong này sẽ đợi là còn bé từ lúc trong xe thả khởi về có chôm họ nó bé trong xe khởiวันนี้ก็ตลอดcòn bé do hai tiaวันđây bé pin nó nên mua lúa đã chỉ nên sẽ nó là thọ nên khai trọc họ kiều này sau này cho lúa nông trong đời bé mà lấy tế này cho lúa lấy bé tế tàu tàu cái đời do hai tia thọ bé chạy họ nó nên lên tới sáng nó có bé chạy lúa mông nó là thọ này mua cho khó cá nếu mua lúc lôm nên nhẹ cho con tới do hai tên này chỉ bỏ lúc lôm nhớ trong tới nếu mua bé tặng nhớ cho sầu xa xì sầu to nên nhẹ con tới nhiều cho nên một tròn tới họ xài lục mông nên thì lấy nó bé mua cho lù hai mà nó xài lục mông nữa ở trong đó.
Thank you, Laura. Next, we'll do Vietnamese. Tyler.
Xin chào mừng quý vị tới diễn đàn cộng đồng về COVID-19 tổ chức bởi Cơ quan Y tế Công cộng quận Sacramento. Để có thể đặt câu hỏi, quý vị làm ơn bấm vào nút Q và A, tức là hỏi đáp, ở phía dưới màn hình và đánh vào câu hỏi của quý vị. Để sử dụng dịch vụ thông dịch thì quý vị xin bấm vào biểu tượng quả cầu cũng ở phía dưới màn hình của quý vị và chọn tiếng Việt, tức là Vietnamese để mà nhận được dịch vụ thông dịch. Cảm ơn quý vị. Thank you.
Thank you, Tyler. Next, we'll do Mandarin. Angela.
嗨，大家好，欢迎参加上我们今天的这个健康论坛。我们是沙加缅度的这个 COVID-19。那你们有问题的话，请你们放在 Q&A 的这个用中文的方式也可以问上去。稍后这个主持人会为您一个一个挑出来您的问题来解答。然后呢，在下面的地球仪当中有一个是中文选项，那您就可以按着进去，然后稍后我们会为您同步的中文翻译，谢谢您。
Thank you, Angela. And next, Arabic. Ahmed.
مساء الخير، معكم أحمد مخيمر مترجم محكمة في كاليفورنيا، وأنا هنترجم لكم الليلة المحاضرة اللي متبنياها مقاطعة ساكرامنتو عن موضوع الكوفيد 19. والمتحدثين في الأول هيتكلموا ويعطوا محاضرة، وبعد كده هتتاح لكم الفرصة انكم انتوا تسألوا اي اسئلة بالضغط على رمز الكرة الارضية، وبعدين الثاني اللي هو Q&A اللي هو الاسئلة والاجابات، وتضعوا الاسئلة بتاعتكم والمتحدث هيتوجه بالاجابات عندكم. ارجو ان كل شيء يكون سهل بالنسبة لكم وتتمتعوا بالليلة دي، ومرحب بكم والف شكر. شكرا. Yes.
Thank you. And thank you to all our interpreters. We
Y
will now
gracias a todos nuestros intérpretes.
begin with the program. Interpreters should all be on their channels and unmuted. So again, my name is Nick Morey. I'm with Sacramento County Public Health. I'll be your host this evening, and we'll be joined by our expert panel. We have Dr. Olivia Kasirye, Public Health Officer for County of Sacramento. We have Linan Svensson, the Director of Nursing and Division Manager for Sacramento County Public Health. And we have Dr. Stuart Cohen, Chief of Infectious Diseases and Director of Hospital Epidemiology and Infection Control at University of California, Davis Medical Center. So each of our panelists will have an opportunity to make opening remarks in just a moment, and then we'll follow that by a Q&A session. And if you're not familiar, there is a Q&A feature in Zoom where you can post your questions, and I'll go through and ask questions of our panelists, and they'll all have an opportunity to answer those questions. I do want to point out that these meetings tend to be very popular, and it's not unusual for us to have more questions than we're able to answer in the time that we have. Sometimes we get questions that are very similar in theme or about similar topics. And so oftentimes what we'll do is we'll try to group those and ask a question that tries to maintain the spirit of those questions, but do apologize that we may not ask your question word for word how you've typed it out. Also, we apologize in advance if we don't get to your question, but we do have a COVID-19 email box. And so if we don't get to your question tonight, you're welcome to email us at covid19@saccounty.net. That's COVID-19@saccounty.net. There's no dash there. And with that, I think we will turn it over to our panelists. So Dr. Kasirye, would you like to start us off this evening?
Yes, good evening, and thank you again for joining us tonight. So I'll start off with just a really brief overview of where we're at with the numbers for COVID-19. And then Linan Svensson will give us an update about the vaccinations and where we're at. And Dr. Cohen will wrap up the introduction by giving us a perspective from the hospital and medical view. So March 19th of 2020 was the first day that we issued our health officer order for stay at home. So it's a year, and we've gone through several iterations of the health officer order. And we've also gone through at least 2 surges of cases of COVID-19. Fortunately, we're at a good point now where the numbers are declining. They're going in the correct direction. And we also have the advantage of having 3 very effective vaccines available that we are rolling out in the community right now. So as of this morning, and these are numbers from our dashboard, we have had 95,837 cases of COVID-19 reported to us. We are averaging about 100 cases a day now. And the 7-day average is 7.1 per 100,000. That is based on our dashboard. We are at 1,565 deaths that have been confirmed due to COVID-19. We still have a number of cases pending because we have to wait for confirmation from the death certificate before we're able to count a case. And then from the blueprint, which determines the level at which we're able to open businesses, the update this week, the case rate was at 8 per 100,000.
每1000个人当中，如果低于8，
He was at
5,2% положительность.
Y para el cuartil de Equidad estuvo en
the state
Nung nakaraang linggo, yung estado.
into the red tier.
دخلنا في
And that was based on us hitting our target of 2 million doses of vaccine in the underserved communities, which represents about 25%
على
of the population in California. So when we hit that, the threshold for the red tier was moved
هي
from
المنطقة
7
الطبقة
to 10
الحمراء
per 100,000.
7 إلى 10.
Since Sacramento County was below that, below the threshold,
كانت
and
أقل
we had maintained that for 2 weeks. On Tuesday, we were able to advance to the red tier,
إلى
which meant that schools are now able to open. All they need is to post their safety plan on their website.
ومع
And
الاحتمال
I know that a number of schools are now in the process of opening. And this is for K through 12.
Từ
And in
lớp mẫu giáo tới 12.
Many of the businesses that were either closed
ال-
or had to operate outdoors are able to now operate indoors. So for example, restaurants are able to operate at 25% capacity indoors.
بالدم
Gyms are able to operate at 10% capacity indoors.
و
And places like grocery stores are able to operate at higher capacity, at 50% capacity. So I know
تشتغل
that a lot of people are very relieved that we are at this point and that we are advancing. But we want to emphasize that we're not out of the woods yet, even though
حالة الخطر.
Dr. Kasirye, I'm not sure if you can hear us. Looks like you've frozen. All right. So I'm thinking maybe while she unfreezes, Linan, do you want to chime in?
Yeah, I'm happy to, and I'm sure she'll finish what she was going to say, which is to continue to do our efforts to stay 6 feet apart, wear our face coverings, all of those things that have been protecting us against COVID need to continue despite the vaccinations that are occurring, and making sure that we can have that safe reopening that we're all looking for. As it relates to vaccine, we have been allocated 20,300 doses for next week, which is exciting. And 11,700 of those doses are Pfizer. We have 7,300 doses of Moderna that have been allocated. And we have 1,300 doses of Janssen, or otherwise known as Johnson & Johnson vaccine. Now eligible as of this week are 16 to 64-year-olds with certain underlying medical conditions that will put them at risk for severe disease. And so super excited that that group is now included in our tiers. We also have our public transportation workers that are included, airport and commercial airline workers. Those are all listed, those tiers, on our website, where we have all of our information about clinics, not only our clinics, but clinics that our partners are holding. and it has as well the tier information. We're working closely with our providers, and we have a weekly call to support them with storage and handling issues, as well as inventory management. And that's been very successful. And we're meeting weekly with our health systems, UC Davis, Kaiser, Sutter, Dignity, to coordinate our efforts and to share resources. And that has been great too. And that's something that really is helping us to have that broader reach throughout the community and a coordinated effort. We continue to operate our Cal Expo site, doing about 6,000 to 7,000 doses a week through that site. And we are doing a lot of workforce populations, but we are open to all qualifying tiers at that site. We also have a McClellan site, McClellan Air Force Base site. We are using our partner Curative as the agency that's delivering the vaccines. They are currently doing about 5,000 a week. They have capacity to do more if we get more vaccines. And they are also open to everybody that is qualified through their tier assignment. And we are working on a third large site for South Sacramento. So stay tuned on that, and we will share that information soon. We are working as well with our community-based organizations to have pop-up clinics, and you might have seen some of those. We're working with those community leaders and also our health equity task force to provide them the vaccinations in our vulnerable communities. And we have many health partners that assist us in these efforts. And that collaboration has been very successful. You might have heard of the San Panel clinic that happened last week, as well as some of the clinics at La Familia. And we are working to have more of those pop-ups throughout Sacramento County. This week, we also started vaccinating persons experiencing homelessness, both sheltered and unsheltered. So we are going to our shelters as well as going to encampments to vaccinate people experiencing homelessness. And then we have put together a strike team to work with our long-term care facilities and adult residential programs, as well as local pharmacies are assisting. And we're working on providing vaccinations to homebound individuals. And then we continue to onboard to MyTurn, which is the new computer system for vaccination registration, as well as continue to work out our collaboration with Blue Shield, who will be the lead in vaccine allocations for the state. That's it for me.
Thanks, Lynanne. Before we jump over to Dr. Cohen, Dr. Kasirye, did you have any other thoughts you wanted to share? We lost you mid-conversation there.
No, my apologies. My connectivity, my internet just cut off, but I'm back. I think I was almost done. And again, just to emphasize that we need to maintain vigilance in continuing to use face coverings and staying 6 feet separated from people who are not from our household, and also avoiding gatherings.
Great, thank you. And Dr. Cohen, any opening remarks before we dive into Q&A?
Yeah, thanks again for inviting me back. I will be brief because there are already a fair number of questions coming up. As has been noted, we're seeing a decrease in the number of patients that we have had in our hospital. As far as the number of active patients, we're about 10% of where we were when we were at our absolute peak. But there are a lot of patients who take a very long time to recover. And so there's still a lot of people hospitalized with COVID. And we're also seeing more people in our outpatient clinic who have persistent symptoms. I think they have a new name for what we used to call long COVID about 2 days ago, is now called post-acute syndrome with coronavirus, PASC. And we're seeing a lot more of those patients now. We are seeing a certain amount of vaccine hesitancy, which I think is one of the great things about these forums, is that we can talk about it a little bit more. And I think that I would like to echo what Dr. Kasirye pointed out. I think we are getting close where we can sort of see the finish line, but we're not at the finish line. And I think if we let things out of control, things can flare again. There still are a lot of people who are not vaccinated, and there's still virus circulating around. So while we can start feeling a little bit relieved, I think it would be a mistake to assume that everything is great and we can start acting like we did in January of 2020.
نتصرف كما تصرفنا في يناير الماضي ثم زادت الحالات.
All right, thank you all. We'll dive into the questions. As Dr. Cohen mentioned, we've got quite a few in the Q&A, and as you might imagine, vaccine does appear to be a popular topic again tonight. So we'll start at the top. We have a couple questions in particular about vaccine availability for younger groups. So currently vaccine available, 2 of them are for 18 and up and 1 is for 16 and up, but somebody's asking about when it might be available, for instance, for 13-year-olds, and another person asking if there's any work being done locally to test vaccine with
疫苗测试在12岁以下的有做
I think that's for you, Dr. Cohen.
Yeah, that's what I was figuring that when the silence hit, that it was up to me. So I will say that there are clinical trials with teenagers that are occurring with both the Moderna and the Pfizer vaccine that are ongoing. We've received an email from J&J that I think they're starting a teenager trial too. I'm only aware that Moderna is the only site that is doing younger kids. And I'm not sure if there's anyone in Sac County. I think that Kaiser may be doing it. At least I've heard that through the grapevine. So, and these vaccine trials take a little bit of time. They'll probably end up taking a little bit longer, given the fact that the rates are lower. Because eventually, to show that a vaccine works, you have to have enough people that get COVID in the placebo arm to demonstrate that the vaccine is effective. And we're still in the middle of our adult trial with the Novavax vaccine, and we're hoping that this gets done pretty soon too, because people are dropping out to get emergency use vaccine, and we'd like to get to where we can say whether this vaccine works or not, so we'll have another vaccine available for people. And so I would say that, you know, summer would be probably the earliest I would think about for younger kids and for tween and teenagers.
Okay, thank you for that. And I'll note, a colleague of mine, Mike, is in the background. You don't see him on screen, but he'll be answering some of the questions that are posted. So some of the ones that we talk about, but also if we're falling behind, he'll try to answer some of the questions behind the scenes for you all as well. So as I mentioned, lots of vaccine questions. Another one here related to the AstraZeneca vaccine. This person says they have a family member living in Canada and they're wondering if it's safe for them to take the vaccine when they're eligible to do so, wondering why specifically it has not been approved in the United States.
So the AstraZeneca vaccine is a little bit of a quandary, I think, for everybody. And let me try to explain why people are a little bit anxious. First of all, the reason that it hasn't been approved in the United States is because they haven't submitted their paperwork yet to the FDA to get approval. So that's a simple answer. I think when the AstraZeneca study was started, there was one case of somebody that had a neurologic complication that was ultimately not thought to be related to the vaccine, but the clinical trial was stopped for at least several weeks. I think it was longer than that. I can't exactly remember. And so that was already got people a little bit anxious about that vaccine. And then subsequently,
بعد ذلك
part of their study,
دراستهم
some of the patients got a lower dose of the vaccine than they thought they were supposed to get. But those patients seem to get higher antibody titers than the people who got the full dose vaccine. And so it also made things a little bit confusing. And then I think most recently, everyone has heard about these blood clots that have been associated, or at least thought to be associated with the vaccine in Norway, although the data doesn't support that, and the rates of blood clots are actually lower in the vaccinated people than you would expect in a general population. So I think there have been these little things that have popped up. The general rule of thumb is to say that the vaccine is safe. I think they will end up probably submitting it to the FDA within the next 2 or 3 weeks. I think that if there's no choice to get either the AstraZeneca or no vaccine, I think you're better off getting the AstraZeneca vaccine. I think as far as how it compares with the other ones, I haven't seen the data in detail, so I can't make any statements in relationship to that. But I think there have been these little things that have popped up that have sort of fed into the anxiety that people have about vaccines in general.
Great, thank you. And I've got another one that might be up your alley, Dr. Cohen, and then I promise I'll give you a break here. You mentioned earlier about vaccine hesitancy, and this person's asking in particular, I say, some people I know are upset by the decision of others to not get vaccinated. They think that's harmful to the community. As long as herd immunity is reached, how can that be harmful?
Yeah, so that's sort of a more of an ethical kind of question than a pure medical question. But I see patients, and when I talk to patients in clinic, I find that there are a significant number of patients, maybe 20% or 25% of my patient population, that basically say they don't want the COVID vaccine. And when I ask them, they can't really tell me what it is that they have a problem with, right? Some people don't take any vaccines, but these are people who do take other vaccines. It's hard to discuss it when you don't really know what you're supposed to be discussing, when you can't really address anything directly. They do sometimes comment that, well, if everybody else takes it, I'll be protected anyhow. So that is a comment that I have heard. As a clinician, I'm not judgmental. That's their choice. And I'm not gonna say anything negative about that. But I think if enough people say that the other person's gonna do it, then there are not enough people who are gonna get vaccinated to make for what we want, which is to get out of this pandemic. And so I think a lot of this, just like wearing a mask and washing your hands and keeping distance, right, everyone's part of the process of getting us through all this. So I can't say much beyond that.
Great, thank you. And so we have some more questions about vaccine here. This one in particular, Harriet's asking about how, kind of about the allocation process. So asking if Sacramento County Public Health distributes all of the vaccine in the county, or do some vaccine sites receive it directly from other sites or other entities? If so, where is their vaccine coming from, the state or somewhere else?
So I will take that. And we do provide vaccine to most of the county. Kaiser gets vaccine directly from the state, and so do our medical health systems. So they are receiving vaccine directly from the state, and then we provide vaccine to the smaller providers. Would you like to add anything, Dr. Kasirye?
Maybe just to explain a little bit about the process that the allocation process and how it starts from the federal government. So basically, the federal government right off the top a certain percentage of the doses that are allocated to pharmacies that have a federal contract. And these pharmacies initially were vaccinating people in the long-term care facilities. And now they get allocations to vaccinate certain sectors, such as teachers or farm workers, depending on what the directive is from the federal government. Then the rest of the doses are divided up for each of the states based on population. And then at the state level, say for California, the state takes off right off the top a certain percentage for the health systems, as Lenan pointed out, Kaiser, UC Davis, Dignity, and Sutter that are locally in Sacramento County each get a certain percentage. And then the rest of the doses are divided up for each of the counties. And the allocation algorithm that they use does change from time to time. Initially, it was based on population of the sectors that we were vaccinating, such as healthcare workers, and also people work in long-term care facilities where we first prioritized. But then as we went through the different priority groups, the formula did change. And so at one point they put into consideration the farm workers. So some of the counties that have large sectors of agricultural workers got more doses. And now they're changing that again most recently because of the recognition that the prioritization had resulted in disparity in how the vaccines were getting out into the community, with some communities not having enough access. So they've changed it around now. So 40% of the doses go to what we call the health equity quartile, which is the 25% of the zip codes that are in the represent the most underserved communities in California. So that's basically a description of how it comes down. It is complicated, so it's kind of difficult for us to know how much we're getting from one week to the other. We get a weekly allocation. And then I think Lenan covered what happens when public health gets the doses. We keep some for the clinics that we run, and then we also are able to assist with some of the other vaccine providers within Sacramento.
So Dr. Kasirye, you touched on the fact that we really know on a kind of a week-by-week basis on vaccine and how much we're going to be getting, which is one of the questions that's come up. Any projections on when adults 50 plus will be eligible, assuming no other underlying conditions or eligibility? You're muted.
Helps to get off mute. It's really dependent on how many doses we get, because this week the eligibility was expanded to include people with chronic conditions that put them at risk, and then also certain essential service workers. So it's going to take a while before we get through the eligible groups that we have right now, especially with the allocations that we're getting. We do hear that hopefully soon that allocation will be increased, but we have no definitive date as to when that will happen. So right now what we're operating on is the expectation that our doses will remain about the same. So at that rate, it's going to be a while before we actually get to those healthy 50-year-olds.
And I think that ties into one of our other questions. You mentioned that we have quite a few groups that are eligible. Do we have any estimates on how many people are in some of those groups in terms of how many people are we looking at that are eligible to be vaccinated?
Well, that you caught me off guard on that one. I don't carry the numbers with me. I do know that
Throw a couple out if you want.
I know that, for example, those 65 and older, the estimate that we had was 200,000. So that gives you an idea of just one group. And then we do have numbers on estimates on the different sectors. And so that's what helps us in being able to calculate how long it's going to take.
Yeah, I'll just throw out there, I do know in some of the conversations in the office, several of the groups were six-figure numbers. So lots of talk about hundreds of thousands of people each time. So we had another question about accessing vaccine. Somebody's asking, what are your thoughts on vaccine chasing? Are vaccination sites like McClellan or Sac State seeing a lot of people lining up hoping for leftover or unused vaccine doses?
To me, the more people vaccinated, the better. However, people do have a plan. Each medical provider has a plan what they're going to do with their remaining doses. And if you plan a clinic right, you don't have remaining doses if you keep track of your supply very carefully. So I would say having too many people congregating at any time is not a good idea. And that, you know, there will be an opportunity to be vaccinated within the next few months, and that, you know, we appreciate the people being excited about being vaccinated.
All right, I think we'll do one more kind of along this theme of vaccines and allocation here. Has there been any significant changes coordinating COVID vaccine efforts now that Blue Shield is involved?
We're still in the process of figuring out what that relationship with Blue Shield is going to look like. Right now, we know that they are involved in making the decisions on the allocation, but otherwise, what else is going to change once they take over is still being worked out.
All right, and I see a few questions in the Q&A about variants. So do we know much about the presence of variants in California and specifically here in Sacramento?
Yeah, so I haven't collected recent data, but we have in our routine asymptomatic testing at UCD, we've identified the so-called California variant. We've identified the so-called Great Britain variant. We've not seen the South African or the Brazilian variants. And I'm using those terms because no one would recognize the numbers when I pass them out. So they're here. We don't really know whether they're in a high percentage because we haven't done enough routine testing of people who are positive. We've seen several people who have turned positive with either mild symptoms or no symptoms after they've had 2 doses of vaccine. And we've sent those off to get tested to look and see whether they are variants that had avoided the vaccine. So the answer is it's present. It's not clear what the numbers are. It's all the more reason to get all these vaccines out as quickly as possible and to limit the number of infections so that this doesn't spread.
And if I'm already vaccinated, should I be concerned about the variants?
Well, I think that's why we're asking people to still use the same protocols, at least when being involved with people who are not already vaccinated. So, I think I saw this, and I expect that Dr. Kasirye will have some comments on this as well. But CDC made some statements last week about the ability of people to see each other without a mask on in small groups, and assuming that both are vaccinated. And that seems to be totally reasonable and hopefully a way to get people more enthusiastic about getting vaccinated. But for example, in our facility, we're still managing people exactly the same way as we did before. And that's because we don't really know still whether the vaccines totally prevent infection or whether they prevent disease, and there are small numbers of people who get infected. And I think there are more data now from the information that was published last week in the New England Journal of Medicine that came from the Israeli experience. And what they saw was that after about 3 weeks after the second dose of the Pfizer vaccine, and that's what they used in that country, there were very few other people infected. And after the second dose, there were no deaths, there were no people in the ICU, there were mild illnesses, no hospitalizations, but there were still a handful of infections. So it's not a big number, but they're still positive. And so that means that if you run into somebody who's not vaccinated, and that would be common in a healthcare facility when you see your patients, you may still be able to transmit to them. So I think we're trying to be cautious, but when you're at home and when you're with somebody at home who's vaccinated, you are safe to be without a mask. And so I think that if that sort of answers the question in a bit of a roundabout way, I think it does address the issue.
Yeah, so Dr. Cohen did mention about the CDC guidance that came out. We have not adopted it yet because the state health officer order still states that everyone should wear a mask when they leave their home, whenever they're in public. So the state is still in the process of updating their guidance, and then we'll be able to change our guidance as well. But as Dr. Cohen mentioned, I think it's still important for people to remember that there are a lot of people who are not yet vaccinated. So it's too early for us to let our guard down. And so we need to continue, especially when we're in public, wearing our face covering.
You know, the one other thing I'll mention is that if you go to the CDC website to actually look at those guidances, they now put these little cartoons up next to their guidance to show you what they're talking about. And they have a little picture of a house like you would draw when you were in 4th grade. And so they're talking about within people's homes. They don't have big pictures of big hospitals or big restaurants or things like that. It's a little home without the little smoke coming out of the chimney.
Thank you both for that. I think you kind of proactively answered a question that we had in here from Harriet. And I just want to acknowledge that Mason took it one step further and asked, now that I have both COVID shots, will I be able to party? So I'm thinking maybe not quite there yet, right?
Absolutely not, because
right.
Parties and gatherings are what got us into trouble with each of the surges that we had. So we're still continuing to urge people to be cautious and to avoid gatherings, and definitely parties. You know, it does put a lot of people at risk.
And I would say if you want to party, party with your own household that's fully vaccinated.
Party tips from Linan. So Dr. Kasirye, that takes us to I think a very timely question. Can you explain how we keep from having the roller coaster effect of going up and down in caseloads with openings? That is, how do we make sure that as we're opening new things here in the red tier, that doesn't then lead to a higher caseload and put us right back where we were?
Yes, we've learned a lot from the past experiences with the surges, and we know the venues and the situations that do have an increased risk for spread of infection. And as we've mentioned a couple of times, gatherings and parties, especially with people outside of your household, that does present opportunities for the virus to spread. The other is that as we are going through the different phases of reopening, we're trying to do it slowly and deliberately and not doing it too fast. And so that's why we are seeing that with the red tier, we're now able to, for example, restaurants are able to have indoor service, but only at 25%. And we're not just opening everything up fully very suddenly, because then that does give an opportunity again for risk of spread. Other things also is avoiding travel, especially outside of the state or to places where we know that there's an increased transmission of the virus. Or if you do have to travel to those places, making sure that you quarantine when you return. And then as individuals, again, the things that we know are preventative, and we keep saying it: face covering, 6 feet separation, and avoiding gatherings.
Thank you. So we have a few questions in the Q&A about the different types of vaccine. So I'm wondering if maybe we could do a quick overview of the 3 vaccines that are currently approved in the United States, what makes them different from each other. And then also a question about how decisions are made about allocating the different vaccines to different sites. Specifically, someone asking about hearing that inferior vaccine being distributed to lower income communities, and if there's any truth to that. So can we maybe just have a little overview of the different vaccines?
Yeah, so I will start, and hopefully this will be reasonably understandable. The way these vaccines are designed is they put the genetic material of the virus in something that can carry the vaccine into the body. So with the Pfizer and Moderna vaccine, the genetic material they use is RNA, and it's put inside what we call a lipid coat, so a fatty kind of coat around the virus. And then it gets injected in your arm, and then it gets taken up in cells. The RNA gets out, and it starts making what's called the spike protein that then is displayed on those cells and starts the immune response, and the RNA is destroyed. The J&J vaccine is uses DNA, not RNA, and it puts it in what's called an adenovirus, which is a normal virus, but it's one that has been damaged so that it can't multiply. So it's still just a little shell that's carrying the genetic material in. And then when the adenovirus gets into the cells, then the DNA is released, which then makes RNA, which then makes those proteins that are displayed on the cells. So the endpoint are a bunch of cells with pieces of coronavirus sticking out of them that our immune system responds to. As far as inferiority or superiority, since these studies were not run side by side and simultaneously, and the Johnson & Johnson vaccine was run a little bit later when some of these variants were seen and had a higher cohort of patients in Brazil and in South America than the other two trials, they're not directly comparable. In addition, how they define severe disease and mild disease is different between the different trials. So they're not directly comparable. So I would not define one vaccine as inferior to the other. We know, for example, with the Johnson & Johnson vaccine, that people continue to make antibodies. Even after one dose, they continue to make antibodies for almost 2 months. The amount of antibodies go up. So it's, so they're not totally comparable. The studies are not comparable side by side. When you look at the numbers, you would say that the Johnson & Johnson vaccine isn't as effective as the other two. But I think that's not effectively reading, because you have to look at the guts of how these studies were run to be able to really make that decision. And I think at this point, it's still, any vaccine that you can get is good. I'm going to say from a medical perspective how we would pick one group versus another to get one vaccine or another. And then I'll be interested to hear what the folks from the health department have to say about that as well. So we look at the Johnson & Johnson vaccine as an opportunity to vaccinate people who are a little shy about needles and are just as happy to only get one shot instead of two. I have relatives like that. I think there people who are less reliable and may not be able to come back for a second vaccine. They don't have transportation. They don't have the ability to get back for a second dose of vaccine. That's a great target. Sorry, my lights go out when I don't move. I apologize, but you don't really need to see me anyhow, and I will stand up in a second and get the lights to go back on. So I think that is sort of the way that we've been looking at it. But right now, in a period where we don't have an ample supply of vaccine, I think whatever shows up where you are is the right vaccine for you. And I think when we get to a point where we have plenty, then maybe we can start making these decisions based on different risk groups. It's also interesting to me that, you know, there are a lot of patients who are getting vaccinated that were not included in trials. So transplant patients, patients with malignancies that are severely immunosuppressed. Those people were not included in clinical trials, and whether one vaccine is better at inducing an immune response in a particular group still is unclear. And so further information should be available as time goes on. I'll stop talking.
And I was just going to say that we're trying to use the Johnson & Johnson or Janssen vaccine on groups that would have a hard time in coming back for their second dose. So people that would move frequently, or where there are barriers to recalling them back to get that second dose. That's how we're currently using the vaccine.
And I do want to add actually to what Dr. Cohen said. We're finding that especially for people who have an aversion to getting stuck with a needle, they really want to get the Johnson & Johnson, because that's a great advantage of not having to go back for a second shot. And so we actually have people calling the health department saying, I want the Johnson & Johnson. We haven't had that happen for any of the other two. So it just goes to show that, people are looking at it just purely from the convenience of, do I need to get 2 shots or just 1 shot? And I also want to emphasize again what Dr. Cohen said, that I think we are very fortunate that we have 3 very good and effective vaccines. And the important thing is that if you get the opportunity to get vaccinated, whichever one you get is the best one for you. So just make sure that you make your appointment.
All right, thank you all. And I'll note that the vaccine sites that we post to our vaccination registration site, generally we post what vaccine is available at that site. So for those that are really concerned and are holding out for one particular manufacturer, you have that ability to at least make an informed decision. So in solidarity with Dr. Cohen, I'm going to turn my lights out for this next question. Along those same lines, somebody asked, like, what if I get Johnson & Johnson shot right now, and then later in the year, vaccine is readily available, and I really feel like maybe I'd rather get Moderna or Pfizer, but I've already had the Johnson & Johnson. Am I going to be able to do that? Is that safe?
So I'm going to make a couple comments on that. So first off, let's just think about flu vaccine. Do you know which brand of flu vaccine you get when you go to the drugstore? Right, there are multiple different brands of flu vaccine. They're all prepared a little bit differently, but we all consider them equivalent, other than the high dose vaccine for us older people. And so that's number one. Number two, I think that, for example, in our clinical trial, if people want to withdraw and get EUA vaccine, they may have actually received a prior vaccine that's a different brand of vaccine. There probably needs to be some study of how these cross vaccines would work, but the likelihood is that it's not going to be a major problem. It's just that I don't think you're going to necessarily need it. And the question also can be raised is, if these variants become more prevalent and we need to get booster vaccines that are targeting the variants, does it have to be the same brand that you got with the original vaccine? And the answer to that is unclear, but because we haven't really done those studies, but there are discussions about doing cross-brand vaccine analyses, both from a safety and effectiveness perspective. If I were to have to guess, which is what this would be, I would say that an educated guess is that it wouldn't hurt you, but you shouldn't really be thinking that way. If you got one vaccine, you're good, right?
Right, thank you. So kind of along these lines, what will determine whether a booster shot is needed after completing a vaccine series? So for Moderna and Pfizer, if somebody completes the 2 shots, or Johnson & Johnson with the 1, will there be a need for an additional shot in the future? And also along those lines, will we have to remember what manufacturer we got a dose from previously for that booster?
Yeah, so I think I tried to address the latter question already. I don't think that you're going to have to know which one you got ultimately. As far as when we know whether we need a booster or not, I think there are going to be 2 issues that will decide that. One is that all of these clinical trials are designed to be followed for a couple of years. And so when you realize how long the immunity lasts, you will determine whether somebody needs a booster dose of a vaccine, right? For example, with tetanus, we booster people at 10 years. But for other vaccines, we booster them more frequently. And that is based on scientific evidence, which will be collected, but is not yet available. Second, if the variants change, the booster might have to be a slightly different vaccine that would target a slightly different strain of the coronavirus. And that raises the question as to whether this is going to be like flu vaccine, where you have to get it year after year. And because this virus doesn't seem to change as rapidly as flu, a lot of people are thinking that it'll be every 2 years or every 3 years that you would have to get vaccinated. And I think the expectation that you're always going to get the exact same brand is probably not realistic.
Great, thank you. So a couple of questions about kids here. One, now with more kids going back to school and recent changes in what's allowed in terms of sports, how do we monitor them to keep them from getting COVID, and is that a concern?
Thank you for that question. I think it's really important for parents to remember the guidance that they've been given, that if your child has symptoms, keep them home. Because we have found oftentimes that is where the spread happens, when people who are having some symptoms that they think are mild, or they think they can work through it, and they still go ahead with their regular activities, only to find out later that they have actually exposed others. So very, very, very important to remember that. The state has also issued guidance to help with being able to monitor that. So for certain sports activities, they need to be able to test regularly. And so I think it's important for the coaches and the schools that are supporting these activities to make sure that they do their due diligence in making sure that they make this testing available. Fortunately, in Sacramento, we do have several sites where people can go to get the tests run, and it's free to the public. So being able to find out where those sites are and make sure that you get the testing if you are involved in activities that bring groups of people together. And again, just being careful.
All right, another question about children. Have we seen an uptick of cases of COVID with kids, and or cases of multi-system inflammatory syndrome?
I don't know if Dr. Cohen wants to answer the question about the multi-system inflammatory syndrome. I know that we have only one case reported, but I'll let you start off with that.
Yeah, there may actually be somebody in the hospital right now, and we've seen one case of this in adults. So I don't think it's increasing in prevalence. I'm not a pediatrician, so I don't deal with it directly, but people are on the lookout for it. And I think that there are cases. I don't see a real flare in the number of cases of MIS-C right now.
I also want to add that we know that schools are able to reopen now, and they can do it safely, but it's important that they follow the protocols that they have put in place, because those systems will only work if everybody follows the same rules. And so again, reminder to parents, teachers, educators that as students are getting back into school, make sure that you're familiar with the school protocols and make sure that you're able to make sure that they're implemented and that students are following them as well.
So we have a question about allowable activities. Obviously, there's a lot of enthusiasm for the fact that we're moved from purple to red. This person notes that the state is opening ballparks, concerts, etc., outdoors soon, and want to know when will restaurants be able to have group dining, like wedding receptions of 100 people or 50 people, and how many people can be seated together at a table indoors or outdoors?
So we're still waiting for additional guidance on that, and the reason being that especially at the beginning, the outbreaks we were seeing were often related to these kinds of gatherings, weddings, funerals, birthdays. And so that's why we're not in a hurry to start to go back to that yet until we have more people vaccinated, more people protected, and the numbers are lower. So we don't have an exact date on when that will be permitted. I know that we did tour one of our local hotels, and they have done a great job in putting together protocols to keep people safe with the social distancing, with keeping records of who's in what room, and also making sure that they have hand sanitizing materials available for everybody. So I think that when we get to that point, and I know that the state is reviewing those protocols, that especially for those that have taken the time to put these protocols in place, that we'll be able to do it safely. But right now, we do not have that guidance available, so it's not permissible at this time.
So Dr. Kasirye, in your opening remarks, you mentioned that tomorrow will mark 1 year since the first stay-at-home order due to COVID-19. And this question's about some of the stresses that have come along with all of the closures and restrictions and fear about COVID-19 and the impact on mental health and other health. Can you talk a little bit about that and what's being done to address that versus the concerns with the health impact of COVID itself?
Yes, we are aware of the impact that isolation has, and also the fact that there are people who lost their jobs, lost their businesses as a result of the closures. But we also need to remember that over 1,500 lives have been lost to COVID-19. Each of those lives does represent a family that is still hurting, that is still having to heal. So that's one of the difficult things in public health, is being able to find this balance. And right now, the important thing at the beginning, as we were going through the surges, the important thing was to protect people and be able to make sure that we got through this and that we minimize the number of lives that were lost. But as we're going through this period of reopening and period of healing, I think it's important for all of us to not forget members of our community that are hurting at this time, people who are lonely, people who have lost jobs, and being able to provide that safety net and that social support. So it's really important. Each of us can play a role in that. In public health, we try, especially working with community-based agencies that are able to do this outreach and being able to provide them with the resources and the support so that they could do it. So, and of course, our behavioral health division as well, they have resources available as well. And it's really important to make sure that we check on one another. I know that a lot of churches also took extra measures to check on people that were in isolation, knowing that some of them, this could tip them over into depression. So very important for all of us to look out for one another. And what we have found, especially for children, because this is one of the areas that we've been asked about a lot is for children that have had to stay home and what the impact has been, and realizing that for families that were able to provide that support for their children, the children fared a lot better. So remembering that, yes, it is a hard time, but you can do a small part of making it easier for someone else just by checking on them, just by making sure that they're okay.
So we had a question earlier about concerns about the roller coaster effect of restrictions followed by reduced numbers, and then we reopen and then the numbers go back up in the cases. This person's asking specifically about, we're currently seeing a surge of COVID-19 cases in Europe, and wondering if we here in Sacramento County should be concerned about something similar happening here.
Well, as we said at the beginning, we're not out of the woods yet. Even though right now our numbers are going in the right direction, they're declining. So that's why it's important for all of us to remain vigilant. It's important for us not to worry too much in terms of, because I know some people hear the news and we've heard of people who have not left their house for a whole year. But at the same time, also, it's important for us to follow the guidance and take measures to protect ourselves and protect others as well.
The way I look at this is that we need to be cautiously optimistic. And because I think we are in the right place. And I think as long as people are smart and don't really jump the gun, right? We've been locked up for a year. I said this the last time we were on. Our first case at UCD was the 22nd of February, 2020, was when the first call came back that the test was positive. And so this has been 13 months since we started doing this. Although it seems like a tough thing to ask, wait 2 more months, right? Get more vaccine out, get people safer, and ultimately it will open. There are countries like New Zealand that granted are smaller and don't have as many people, but they've controlled this without vaccine. So as long as people are smart and give the vaccine a chance, we will be able to not see a surge. And I am very hopeful that we will not.
And one of the positive things that has come out of this is the closeness that we have with our families, both physically and mentally. I'd say, that's mostly positive. Sometimes that can cause problems too, but enjoy your family for a little longer. As Dr. Cohen and Dr. Kasirye said, let's get some more vaccines in arms and get that immunity level up so that we can enjoy more safely with one another.
All right, I think that segues nicely into this next question. Grandparents have seen in the media that they are now safe to be around their grandkids without masks. Is there any risk to the still vaccinated adult parents and kids with spending time unmasked inside for long visits? Some grandparents have shifted their habits to spending more time in public now, and they're vaccinated, while a lot of families are still being very cautious. So how do we balance that vaccination with wanting to be together?
I'll start off, but I welcome input from Dr. Cohen and Linan as well, because right now, because we still have a lot of people that are not vaccinated, I think we need to continue being cautious. I know that especially for people in long-term care facilities, it's been really, really tough on them, being in isolation and not being able to see their loved ones because visitations were strictly limited. But we do need to remember that we need to do this slowly, in phases and deliberately. So the state has released some guidance about being able to ease up on some of the restrictions for visitation. And so being able to make sure that we're able to move through this. And of course, also making sure that if somebody has symptoms that they need to stay home, they should not be gathering with others. But I think over time, we're going to be able to get to that point, but just being able to do it in phases.
And I'd just like to say that I have a couple of parents that are seniors in their mid 80s, and they have, you know, some conditions in which I would not want them, even though they're fully vaccinated, to go out in public. And we are, as far as going out in public without protective measures. And so we are still very diligent with them. I think it's important that people that have those, you know, types of conditions and are seniors, that you are extra vigilant with those individuals still, because this, but also balancing that with allowing them to have some socialization with people that are also fully vaccinated.
So it seems this, oh, go ahead, Dr. Cohen.
I was just going to say, a lot of this is just common sense, right? It doesn't have to be all or nothing. I'm a senior, and right, and I'm trying to be still very cautious. I've been vaccinated as a healthcare worker. I've been vaccinated for fully vaccinated for a month and a half, and so, but I'm really not in a rush. And I think, you know, little things are going to be good. Seeing our son without a mask on is going to be the first time in over a year, and so that's not bad. That's fine, right? Baby steps, right? That's the first step. I don't need to go to a restaurant now. I want to make sure that I keep myself safe and keep others safe. Sorry for the restaurant industry. I apologize.
The Restaurant Association is Googling your email address right now. So I think we prompted another very specific question along these lines here. This person asks, my Aunt Sue wants to get a few of us together, but only 3 out of 4 of us are vaccinated. Can we still gather? So
I think the CDC guidance was clear on that gathering without a face covering, it should be for people where all of them are vaccinated. So if you are going to do it, because I know that the state guidance, it does allow for small gatherings of up to 3 families. So I think, again, if you do it, you need to make sure that you continue to follow all of the precautions.
we have a couple of travel questions here. One asking when we can fly again, and the other asking if the advice about quarantining after travel also applies to those who are fully vaccinated.
The state has not completely reversed the restrictions on flying, especially for travel that is for leisure. And the reason for that is we want to, again, take small steps at a time. And we still know that there's a lot of places that still have high rates of COVID-19 in the community. So it's important for us to remember that if you can put off the travel, that you do that. And yeah, what was the second question? Sorry, I forgot on that. The second part.
Well, one, if travel, if people can fly, and the other about the quarantine,
Right.
The CDPH quarantine.
So
the CDC, if somebody's immunized.
Right. The CDC has provided guidance for that if someone is vaccinated, that they do not have to quarantine. if they are exposed. But of course, if you do exhibit symptoms, then you do have to go into isolation.
And we're on the home stretch here. Just a few questions left. This one's specific to schools, asking if, so the CDC recently made some announcements about changing guidelines in schools related to distancing from 6 feet to 3 feet. So wondering if you can talk a little bit about that. And the question also asks if masks are going to be required in classrooms.
Masks are required in classrooms. The distancing, yes, we are aware that the CDC did release some studies about changing the distance from 6 feet to say that 3 feet is actually effective as well. We are still considering those studies and those changes, and also waiting for guidance from the state on that so that we are all consistent. So stay tuned.
I'd like to add that when we are looking at somebody who tests positive and we are determining who is a close contact to that individual, we look at that 6 foot distancing, anybody that is within 6 feet. And so even if the state does move in that direction and we are able to go to 3 feet, what that will do is it will impact classrooms and or teachers in that more people will have to be excused or quarantined if somebody tests positive within that classroom. So it's a positive thing in that it might give more schools the ability to open up because they'll logistically be able to handle that. But it also will, it could potentially lead to more kids being placed on quarantine in classrooms when there's a positive person.
All right, here we have a question about vaccine. Can a primary physician refuse their patient the vaccine, even if the individual falls within the current tier that is being vaccinated? And if that does happen, what recourse would the patient have?
I would just like to say that not every provider has access directly to vaccines. A lot of the vaccines are going through the health systems. So individual providers, there's not a lot, to be honest, who have vaccine in their possession. So hopefully, if you have a medical provider, they know and can plug you in to their health systems clinics so that you can be vaccinated. And if not, then I would say, please go to our website and get into one of our clinics if you fall within the eligible tiers. We want to make sure that access is provided throughout the county.
We talked a little earlier about the kind of specific benefits of a one-dose vaccine, and there's a question here about how are we going to ensure that the homeless community in particular receives a second dose of vaccine. So kind of teeing it up for a J&J answer here.
Go ahead, Lynette.
I was just going to say that we are currently using Johnson & Johnson for our individuals that are experiencing homeless in our communities because of that very reason. It can be challenging to get a second dose or recall for a second dose due to how they might move around. And so luckily at this point, we are able to utilize the Johnson & Johnson or Janssen vaccine for people that are experiencing homeless in Sacramento County.
And I've got one last question here that I think you may have already partially addressed. How far out on the calendar or how many series of shots do you estimate that the public will need to have coverage for the variants and future variants? Maybe some predictions about the future of vaccine.
Well, let me just start out by saying that I'm aware at least of Moderna already doing some preliminary studies on a vaccine that targets the variants. So, so there are vaccines that are already being developed. When they would be necessary and what the timing would be is going to partially be related to how the rest of the pandemic goes. If things calm down and we don't see another wave in the United States, there may not be a rush to get out a variant vaccine. And we may start seeing what we see with flu vaccine, where there are 2 or 3 different strains of virus in each vaccine. And so I think a lot of the timing is going to be based on how the pandemic progresses. If things calm down and the number of cases go down significantly, there may not ultimately be the need for boosting early. Otherwise, we may be in line come fall time to get our booster vaccines.
All right. So we're running out of time here. A couple of last minute questions. I know we talked about this earlier about a potential timeline for when kids can be vaccinated. Anybody want to give like a 15-second recap on that answer?
Studies being done. Sorry, Dr. Cohen, go ahead.
I was going to just say, for kids, let's just estimate that it's going to be sometime in early summer before all the data are out and the kids will be able to get vaccinated. And there's one other comment in here that I can answer to save a tiny bit of time. If you miss your second dose by a couple of weeks, don't worry about it. CDC says go out to 42 days. I think that's probably being conservative as well. So you don't have to start all over again if you're a few weeks late.
Thank you so much. And with that, we actually answered all the questions, I believe. So that might be the first in a while. So we are at the end of time. So I would just like to again thank everybody for joining us this evening. I would like to thank all of our interpreters, Frida, Alexander, Miguel, Laura, Tyler, Angela, Ahmed, Cindy, and Jordan. Our panelists, Dr. Kasirye, Linan, and Dr. Cohen. And with that, we'll sign off and wish you all a pleasant evening. Thanks, everyone.
Thank you.